Now I'd like to talk a bit about the differences that I have observed in reactions of males and females to the infertility experience. These are not universally accurate, but in general I have found that with men, the reaction to infertility tends not to be a particularly emotional one. Men have tended in general to be fairly hopeful and fairly inquisitive about the tests and the process. They are interested in talking with the physicians about the game plan, about what the issues are that are going to be looked at, and they are often quite absorbed in the technicalities of the infertility treatment. Even without any attention to their emotions, what men will do during the course of a week or a month, as they are waiting for the woman either to become pregnant or not to become pregnant, is to absorb themselves in their work or in their hobbies. I often see this as a way of avoiding some of the emotions either that they have or that their partners are having. So for males to understand that the motivation behind taking on extra work or becoming especially absorbed in hobbies may have a bit to do with avoiding the pain of infertility. This isn't wrong. It's sometimes the best protection one can have in terms of being able to have life proceeding as normal. It is also the case that males are often fairly uncomfortable with the emotion of their partners. If the partner is tearful, is emotional, the male's reaction is often to try either to comfort her by saying, "It'll be all right, I'm sure you'll get pregnant next month," or to say that her overreaction is something that he is finding difficult, and to encourage her to try to contain her emotions. Needless to say, the woman doesn't tend to feel very supported when this reaction occurs, and men are simply going to need to learn to ask their partners how they can be most helpful and supportive. What does not work for men to do, that men often do, is to try to fix things up, to try to be reassuring, to try to say, "I'm sure it'll be better in a month, in 2 months, in 3 months." This doesn't convince the woman at all. What she really needs is an opportunity to be listened to. And many men are not as patient about being able to listen quietly without even responding except to hug or to hold. But this will work much better in the cases of many of their partners. I'd like to talk about the reactions that women tend to have around infertility. Women tend to be fairly expressive in terms of their emotions, but also fairly worried that in expressing those emotions they may cause stress with family members, with coworkers. So at the very time that a woman needs to express her emotions, she's also very cautious about how to do this and with whom. Many women at a very time that they say they would like to express their emotions will also say that they are feeling socially isolated. This is because infertile women tend to be at an age when many of their peers are having babies, are pregnant, or have young children who occupy their time and interest. Infertile women then feel as though they don't have anyone with whom they can talk about their sadness, because so many of their peers are involved in reproductive happiness rather than sadness. Another issue that women face in terms of emotions is that they constantly are monitoring the reactions of family members. Many family members will call, will encourage the infertile couple to try new strategies, to change physicians, to think about adoption. They really get in the way of the infertile couple's decision making because they are trying to be helpful. And it is usually the woman who tends to need to negotiate the family communications, to discourage people from inappropriately getting in the couple's life around their decisions. And it's stressful. It is also the woman who is most likely to experience the medical treatments that are disruptive. She is going to have to schedule appointments. She is going to have to take her temperature or use charts or various kinds of tests to determine when she is ovulating. She is going to need to take medication. She is going to need to do a number of things which will determine the point at which she's going to be going for an infertility treatment. As a result of this, it is the woman who often feels that her life is especially disrupted by infertility, particularly if she has to travel long distances to an infertility clinic. particularly if the way in which the infertility treatments are being given are disruptive and cause her to need to miss work or to miss participation in events that are important.